deepest cuts I heal by faith. Now I believe there comes a time when everything just falls in line. We live and learn from our mistakes. The deepest cuts I heal by faith. Now I believe. All fired up. All fired up. All fired up. All fired up, fired up, fired up. Now I believe there comes a time when everything just falls in line. We live and learn from our mistakes. The deepest cuts I heal by faith. Hi, welcome to ReneMarie. Music, yes, I love music. Jim must know I love music. Are we free, Jim? Is everything okay?
That's interesting, yeah.
What was it? What was the song?
That's my end credits.
Ah.
But for some reason, they're attached to your beginning credits.
Oh, well, yeah, no, we have a long show, and maybe we'll have a little bit of extra show today, but we'll see what we have moving forward. We're live all the time, and we just wing it. Our philosophy is winging it is recommended and approved. We come up with a timeline, of course.
But we don't always
stick with it. Like, things just take us where we want to go, you know? So, anyway, thank you so much for joining us on a Sunday, and we're really honored and privileged to have this platform because, you know, we have such a passion to bring awareness to strokes and aphasia. And today we have two incredible really passionate people as well, who are doing incredible work in the stroke and aneurysm area. And I love to meet people like that because they're on the same page as us and really making a difference in the world. And it really is an important thing because I don't need to say this all the time, and I will be for those that are just joining us now, but 80% of strokes can be prevented, and strokes can happen at any age. I was 26 when I had my stroke. I know there was an 11-year-old boy in my town that year that had a stroke. I met a little girl that her brother was born with a stroke. Nancy on our foundation board, she suffered a stroke at a young age. Virginia suffered a stroke at a young age. So, it really isn't something that is for your grandparents. And when people think of strokes, they think of grandparents, and they think that it's just an elderly disease, and it's not. It's not. But today, Dr. Kimon and Jason Wallen? Yes, I said it good. Dr. Kimon is you're a neurologist, am I correct? Neurosurgeon. He's a neurosurgeon. Wow, unbelievable. And Jason is a radiology. What how do you say it?
Radiologic technologist.
Oh my God.
An X-ray tech.
An X-ray tech. That's what I like. X-ray tech.
We're trying to confuse you this morning.
But the reason that this is going to be a very interesting show is because we always talk about 80% of strokes being preventable. But in this area, an aneurysm, you can't prevent it. So what happens before? How do you know that something is going a little astray in your brain? What do they do afterwards? And where are they going with this awareness that they're so passionate about doing? As a matter of fact, when they leave today, they have another engagement at a church, I believe you said, at a church. So they're very, very passionate, and we're really honored and privileged to have them as
we certainly
our guests today. We are.
Thank you guys.
You're-
Renee, Judy, Jim, thank you for having us.
You're welcome. You're welcome. Before we begin our talk, though, I just want to, first of all, I want to thank Jan, because once again she is sponsoring this show, and she is an incredible, she was a doctor when she was in China, as everybody knows, and when she came over she wasn't able to be a doctor because you have to go through the schooling once again, so she tapped into acupuncture and herbalist, and she is such an incredible individual who has a passion to change lives, and she wants to bring healing, to those. And in our world, there's different ways to heal. There's different ways. There's chiropractors, there's doctors, there's acupuncturists, there's herbalists, there's physical therapists, there's prayer, there's a whole bunch of different ways. And we always tell everybody they have to get that network of people around them before something happens, so that you have that network to support you when when something does occur. So in a little bit, we're going to show Jan's commercial. But before we get there, like I said, tonight is the beginning of Hanukkah. And Judy is of the Jewish culture. And we're going to give her the opportunity to say a few words about the Hanukkah. I think it's a celebration of lights. Am I correct?
Yes, it is.
Celebration of lights.
Hanukkah celebrates two miracles. The first is the victory of a small army of Jewish people called the Maccabees over the powerful army that was occupying Israel. And this happened 2,100 years ago. At the time of the redemption of the Holy Temple in Jerusalem, there was very little oil left, that it had been defiled by the enemy. Oil was needed for the menorah in the temple, which was supposed to burn for 8 days. But they were out of oil. They only had a little oil. So there was only enough to burn, as I said, for 1 day. Yet a miracle occurred, and it burned for 8 days, giving them time to prepare a fresh supply of oil for the menorah. The holiday celebrates the miracle of the oil, not the military victory, for the Jewish people do not glorify war.
Wow. Now, I worked in a community that was 50-50, half were of the Jewish culture and half were of other faiths. And I remember right at sundown, that's when they light the first candle.
Yes.
Every day we would light a candle at sundown. Am I correct in my thought pattern?
It starts with the middle candle, and then you light the one on the left.
We should have brought one in. I'm sorry. I just not thinking clear. But that would have been awesome too.
Yes, I should have done that.
But we couldn't light it yet because that's disrespectful to the faith. But we could have had a menorah here. So I'll put it on my Facebook page. And I'll send it. When I send the rewind out, I'll put a little menorah. I'll put a little menorah there, so I can touch on everybody. So and what does a celebration of lights mean, Judy? I mean, I don't know if you know the actual.
It was the miracle that the
oils burns.
Yes, that was because they needed it, and when they have the oil for the lights. The oil is also used in preparation of some of the foods like potato pancakes, which is one of my very favorite.
Are you going to have some tonight?
Definitely. I'm going to have some for 8 nights.
That's good. So
I used to make it with my mother. I used to see how she made it from scratch. And of course now I don't make it from scratch, but I know how to do it.
Yes.
And I remember it being one of the first recipes that I wrote down.
Wow. So what do you, because I want to make sure I get this correctly, because we want to wish all our Hanukkah family members
just happy holidays, happy Hanukkah.
Happy Hanukkah, that's what you say?
Yes.
Because I don't want to disrespect, because I always ask like a Rosh Hashanah or
Yom
Yom Kippur, like what the actual verbiage is that you're supposed to.
That's the Jewish New Year.
Right.
And Yom Kippur is the Day of Atonement. Yes.
Atonement. And what do you say in because there's a verbiage you're supposed to say.
You want me to say something?
No.
I'm not very good at that.
No. I think what isn't there a verbiage like you're supposed to say when you wish somebody? You can't wish them have a happy Yom Kippur. You have to say.
Well, on that day we do memorials for the people who have passed.
Right.
We remember them that way, and we give out their names and we talk about them.
Wow. Okay. Well, have a happy Hanukkah, everybody. All of our family friends that are of the Jewish faith, and
I get to celebrate all the holidays.
Yes, you do. Yes, you do. And I was going to say that, it's a day that we should all celebrate all the faiths. We should all come together and respect and celebrate other faiths. It's
Not only do I get to light the menorah, but very shortly I'm going to be putting up the tree and putting every decoration on the tree, because I'm very fussy about what goes on the tree.
And Judy is married to an Elvis impersonator, so
yes, Elvis is on the Christmas tree also, and there's a beautiful Christmas village under it that I personally do.
So
Hope it's not a blue Christmas.
All right, so let's get to the commercial so that we can get that. You could share that right before. It'll be a good segue into the conversation. It's a good, really important conversation we're going to have with our two very special guests. So, Jim, can you show the commercial?
I am New York licensed acupuncturist and herbalist. I specialized in men's health issue, women's health issue, after stroke syndrome, pediatric diseases, and pain management. Acupuncture and the Chinese herbs are amazing. It's been in China for thousands of years, and it helped tons of people out in different situations. My job is very simple. I try to relieve your pain, help you out, and improve your health. I can treat a little bit everything from weight loss, facial rejuvenation, spondylitis, immune system diseases, ADHD, autism, mental disorder, all kinds of pain, stroke, and aphasia. When I was partnering with ReneMarie Language of Love Foundation, I also think it's amazing work they are doing, because they let more people get to know acupuncture and Chinese herbs. I think education is very, very important. Not only in school, but also the whole world need to know how to prevent and how to treat this stroke. And the patient will lie on the bed, and we have the beautiful music. They can help the patient relax. And this is all kinds of needles. We have different gauges, different sizes from 0.5 ton to 3 ton, according to different situations that can help patients relax during the treatment, and also it can improve the treatment function. So we have hundreds different kinds of herbs. According to the symptom, we will prescribe you different formulas. So we will put different kinds of herbs together to make your own formula. Very easy to drink, just like a tea bag. You can tear the bag and put all the granule into the hot water, dissolve it and drink it, just like tea bag. It's very simple. Once a day, 1 bag at a time. And according to different symptoms, like common cold, you can see the difference right away. Like a chronic disease, it may take a while, like several days to 1 week to get affected.
So, Jen, I had a stroke over 8 years ago, and I had aphasia. It's pretty good now, but I'd love to make it better. How could you help?
I would use scalp needle, because certain area of the brains can control the language. You have aphasia. Some people, they cannot even talk. Actually, you're in a good situation right now, and because I can tell that you can speak fluently. Some patients, they cannot.
I wasn't able to originally.
Oh, okay. So I can use acupuncture to put in the certain area of the scalp, and it can help you to improve the language, the speaking.
I have a question
Call
about
me
the needle.
347-925-6995, or you can go to my website, yyyacupuncture.com, to make appointment.
That sounds great.
Thank you.
And expect a call from me.
Okay, thank you so much.
Simon.
Kimon.
Kimon.
Hi.
Say it again.
Welcome
Just say
back.
it.
Kimon.
And we want to once again thank Jan for her support and really partnering with us, because we love to get people and really partner with people and all vendors and doctors and medical and stroke patients and stroke survivors and families, and because it affects everybody. A stroke affects everybody. It just doesn't affect that person that has had the stroke. So let's get to this really important conversation. And we're privileged to have these two individuals on the show. Dr. Kimon
Bekelis, yeah.
Kimon. I will get it right. Kimon is like.
Did you want me to read
Wait
Not
a
yet?
second.
Okay.
Kimon and and Jason. How do you say your last name, Jason?
Wallen.
Wallen.
No, I'm a little bit easier.
Yes. So I think, I'm not sure if that's one of my stroke residuals, that it's hard for me to remember.
I'm horrible with names too.
I don't think it has anything to do with stroke. I have the same problem.
Yeah. Okay. So let's introduce them. Are they on the camera, Jim? Put them on the camera. And so to the left, I believe he's shown to the left, Dr. Kimon.
This guy right
Dr.
here.
Kimon. That's Dr. Kimon, and that's Jason
Yes.
Walden.
She's gonna keep saying the names until she
Yeah,
gets it right.
yeah. Kimon Walden. Okay, the show is over. No. Anyway, so tell us a little bit about yourself. Dr. Kimon, you begin.
Sure. So I'm a neurosurgeon. I'm very passionate about stroke and brain aneurysms. This is the area that we work in, I would say, in the vast majority of times. I trained at Dartmouth in New Hampshire, and then did my Neurovascular fellowship, which is subspecialty training in minimally invasive ways to treat stroke and brain aneurysms. And I did that at Thomas Jefferson Hospital in Philadelphia, which was one of the first centers that integrated these new skill sets into the armamentarium of a neurosurgeon.
So just let me
Please.
ask, because otherwise us lay people get a little lost in your medical knowledge. So you're talking about non-invasive, is that what you said? Like what
Correct.
is non-invasive?
So minimally invasive techniques. So a stroke, and we'll talk about both, but a stroke is a blockage of a large blood vessel or a smaller blood vessel. And think of it as a heart attack for the brain. There's a blockage in the blood vessel. The blood doesn't make it to the brain dies. People develop a deficit. They cannot move one side. They cannot talk, depending on the area of the brain that was getting blood.
Right.
In the past, we had a great medication. We still do, which is the IVTPA, a clot-busting medicine. You had to give it within 3 to 4.5 hours to the patients, and that would break up the clot, break the blockage, and allow the blood to flow again, restore function. However, there were a lot of downsides to that medication. The risk of bleeding was one of them, and also the time frame that you could administer the medication was very limited. Additionally, the more devastating strokes, the strokes where somebody's weak on one side, is unable to speak, is aphasic, and I know you guys are very sensitive about aphasia. Those strokes had TPA had limited impact on them because they were the result of a large vessel that was blocked, and TPA was not able to break it down. It was only able to break it down in a third of the patients. So a few years ago, and it's not a long time ago that these techniques have evolved, maybe in the last 5 years, new techniques developed where we're able now to go in through the groin, and that's the minimally invasive component.
Okay. Rather than cutting in the head.
Exactly. Navigate our catheters and wires all the way through the body, up into the
Wow.
brain, and then find the blockage and fish it out of the brain.
Is that what I understood as a stent, like for the brain?
It is a stent for the brain, but the stent is not permanent most of the times. It's a stent that you use as a fishnet to capture the clot, and then you remove it with the clot out of the body. The medical term for the procedure is called mechanical thrombectomy, which is really the removal of a blood clot from the brain. And we use multiple techniques. The stent is one of them. Suction is another. But the goal is to be able to open the brain. And what this technique allows us to do is actually expand the window. First of all, we're able to treat the most devastating strokes, the strokes that make people either end up in nursing homes or dead. And we can do that now, expanding the window of treatment all the way up to 24 hours in appropriately selected patients. We have.
So you're saying that if somebody has suffered a stroke, it used to be like that 3 to 4.5 hour window that you, from the onset. It wasn't even from, when you found the person, because when you found them, you didn't know when the onset was.
Exactly.
And if they were alone, you wouldn't know when.
Exactly. So
Right.
we had
So
all
how
these.
do you determine, how do you determine, because if you find somebody, even if it's 3.5 or 4.5
And you
hours,
don't know.
because some people suffer a mini stroke or a stroke and kind of come back and then have another stroke, and you don't know you're having 2 or 3 strokes.
Exactly right. And that's a very good point that you're making, because in the past, if somebody was found down or they woke up with a stroke, very commonly the wake-up strokes happen, you had no treatment for them because their last known well was 12 hours ago when they went to bed and spoke to somebody on the phone.
Right.
Well, now this is not necessarily an issue, because these folks we've expanded the window up to 24 hours. So, if they were last seen normal the night before, they're still in the window. However, we do advanced imaging techniques called CT angiogram and CT perfusion that allows us to determine whether the brain is still alive or not.
I see.
So the time is less important nowadays. What's more important is if the brain is alive or not, and we have the ability to determine that in the stroke victims. We can tell that the brain is starving for oxygen, starving for blood, but it's not dead yet. And those are the perfect patients for us to intervene on. It doesn't mean that if you're having a stroke, you should delay getting care after 24 hours, and I want to clarify that. It just means that we can expand our window. The quicker you get to the hospital, the quicker you get treatment, that might be TPA, mechanical thrombectomy, any sort of treatment, the higher the chance that you will recover. And every 15 minutes lost is a significant amount of disability and less chance of recovery.
Right. That's why when we talk about fast,
Exactly.
when we talk about time, we always add on that time is of the essence. However, when you're calling that 911, you need to let them know that it could be a stroke.
Exactly.
Because they will go into stroke mode, they will start to look for those signs, and they'll pass triage when they get to the hospital if
Because it's an emergency.
Right. If the signs all lead to that, and they'll go in for a CAT scan.
Exactly right, and that this is another good point. Calling 911 allows not driving to the hospital. Obviously, serves two purposes. One, if you're driving to the hospital with a deficit that you don't have a lot of control over, you're putting yourself and others at risk.
Right.
The second and probably more important problem that gets resolved when you call 911 is that emergency medical services know exactly the hospital to take you. There are hospitals, and we're on Long Island, so obviously we're very sensitive to the community here. There's hospitals that are there's several layers of stroke care everywhere in the United States and on Long Island, and there's primary stroke centers and there's comprehensive stroke centers. And primary stroke centers are great at offering the immediate first services, including TPA, and then there's the comprehensive stroke centers, one of which is the Stroke and Brain Aneurysm Center of Long Island, Good Samaritan Hospital, where Jason and I work, and those can offer you the services such as mechanical thrombectomy or the ability to treat brain aneurysms, which is obviously our second passion.
Jason, tell us a little bit about how the work you do with Dr. Kimon.
So when Dr. Bekelis came to Thomas Jefferson to do his fellowship, I was there for 9 years, and I got to see the advances of technology. When I say leaps and bounds, the technology that we use every day I mean, right now in development, it's almost like your cell phone or your computer. By the time you get out of the store, they're probably already rolling out a newer,
Right.
better model. So the technology, even from the machines that we use, are so intricate. Like Dr. Bekelis had said, the CTA and CTP, the angio and the perfusion studies. Not every hospital can do that.
It's a perfusion study.
So that's what he said. It takes a look to see if the brain is salvageable or not,
Okay.
if the brain is dead. Only certain hospitals have that technology. So when Dr. Bekelis came to Thomas Jefferson, he convinced me to come up here and help start when we came here, there was nothing at Good Samaritan Hospital.
Wow.
The dedication that Good Samaritan gave to the program was extraordinary. From accepting that he had handpicked some people, myself included, a nurse practitioner from Boston, Maddie, that's integral to the program as well. And they were very welcoming of everybody. They were all bought in with getting whatever we needed, making sure that the hospital had everything we needed. They opened up a neuro ICU, so there was a lot of planning that went into that.
This is very exciting because it used to be where strokes wasn't on the forefront of the care, of the awareness of the industry. And this is nothing against them, but cancer and heart attacks, and they were really the forefront. People would talk more about that.
Mm-hmm.
But strokes, it's the leading cause of disability in the country.
In the United
So-
States, correct. That's absolutely right. Leading cause of adult
right.
disability.
So I'm so happy that you guys are doing what you're doing, and honored to have you because, like we've been talking about it for 26 years. How are we gonna change it?
For sure, and Renee, Jason's making a great point. It kind of touches upon what you're saying. In the South Shore of Long Island, last year or a year and a half ago, if you were having a stroke, that was a big problem. The closest facility that can offer the services that we're offering now was an hour and a half away at least.
And an hour and a half in a 15. You just said every 15 minutes.
15.
Every 15 minutes, it makes a huge difference in
your
the
outcome.
recovery.
Exactly.
We say
right.
time is brain. That's our saying.
Yeah.
And before starting the program, and that's the reason, frankly, I came. I saw a big need in the area, you're in a metropolitan area practically, and you do not offer those services. That was a big void, and I think that was also from the institution side and the leaders side. They had the foresight to understand that we're going to make a difference in this area, and that's why I convinced folks like Jason or Maddie and about 5 other families to come with me and start this program.
And how did you know Jason?
Because
I'm sure you were picking people along your way.
I was.
Were you from Long Island?
No, I wasn't. The reason I came to Long Island, the reason I got attracted to Long Island is that I trained with another neurosurgeon who was practicing at Good Samaritan Hospital, and I got a call. And at the time, I was interviewing in multiple places in the United States, and I got a call by this friend who said, you know what, there's an opportunity here to make a difference, and here we are a year and a half later, having treated over 500 patients and really changing the way stroke care is delivered. We came to a hospital that did not offer those services, and in less than a year, we are now certified by the Joint Commission as a comprehensive stroke center.
Wow, thank you.
Thank you.
You have out centers at other hospitals, clinics?
Correct. So the way we do this program is based on the hub and spoke model. Good Samaritan Hospital is the hub where these services are being offered. However, we want to have outposts so that if somebody shows up outside of Good Samaritan Hospital, they can quickly be transferred and receive those services. So St. Joseph's Hospital is one of them, St. Catherine's of Siena, St. Charles up at Port Jefferson. So all around Suffolk County, for this part of the program, we have hospitals that are primary stroke centers. They have tremendous credentials in administering TPA in a timely manner and with a very high percentage of patients, because nationally TPA is not administered in more than 10% of the patients, actually a lot less.
They don't want to risk it. They don't want to take
In case
the
the
chance.
person's having a
Yes.
bleed, they have to do an
Exactly right.
MRI or...
And the truth is, what's the alternative?
Exactly.
What's the alternative?
Exactly.
Because, I'm blessed to be able to sit here and have a conversation with you, but there are so many stroke family that or aneurysm families that they don't recover. They don't recover.
That's exactly right. And for all the things we do in dealing with blood vessels in the brain, the strokes, brain aneurysms, they don't care whether you have obligations the next day. They don't care
Right.
what you're doing.
No.
They happen instantaneously. They change your life. And we're trying, obviously, we're there when somebody needs our help, when a stroke happens, when a brain aneurysm ruptures, but we're very, very aggressively trying to address these diseases before they happen, either with procedures, say somebody has carotid disease, and we take care of that problem for them either with a stent or with an open surgery to prevent a stroke from happening from their carotid. Or if we find a brain aneurysm, we use the same techniques that I described through the groin, navigating our catheters and wires all the way into the brain and filling up the aneurysms. And aneurysms are, think of them as little balloons on the side of the blood vessels that can burst. And if they burst, blood goes everywhere, and it's deadly about half the time, right on the spot. These folks never make it to the
And the
hospital.
symptoms are severe headache?
When an aneurysm ruptures, it is the worst headache of your life. And that is the most common symptom. And I would say if you're suffering from headaches that are getting progressively worse, don't ignore it.
Yeah.
You can have brain aneurysm rupture, and then you can have a devastating rupture after the first one, and that could be the deadly one. We're very passionate about brain aneurysms. The ability to change the course of the disease that is so deadly and takes people in a very young age, in the majority of the times, is really something that we see as our mission. We're trying to increase awareness. It is true that on the brain aneurysm side, and not to veer off too much from stroke,
That's okay.
but on the brain aneurysm side, there's really no screening out there.
Right. But brain aneurysms is a stroke.
Exactly right.
Yes.
Exactly
It's a
right.
it is a stroke.
Form of a stroke.
Yeah.
Stroke, two large categories.
Right.
The stroke where the brain is starving for oxygen, the blockage
Right.
type of stroke.
Right.
It's called
Right.
the ischemic stroke.
Right.
And then the stroke where there's too much blood, the
Right.
bleeding type of stroke. And,
Right.
and one of the major causes of that is the brain aneurysm. But yeah, so there's necessarily no screening tool. There's tests where you can find a brain aneurysm, but they haven't been embraced by insurance companies or
That's a shame.
Don't even talk to me
or-
about insurance companies.
I know. Or necessarily by lawmakers to really, get identify those silent killers before they rupture. And treating a brain aneurysm these days, and we treat elective brain aneurysms all the time.
What are elective brain aneurysms?
Elective means haven't ruptured.
Okay.
Meaning
They're gonna rupture.
non-emergent, correct. If you don't treat
They're
them,
forming.
they have the potential to rupture. And we treat them, we treat aneurysms like that every day. If your aneurysm is amenable to treatment through the groin with minimally invasive techniques, you feel the same way you felt before the procedure. Most of the times, folks are questioning whether we did anything because they feel the same, and they're able to go home the next day.
That's wonderful.
With a needle stick in their groin. That versus the alternative, which is devastated family, is obviously much different.
But the key is to always keep going to your doctor. Keep your levels. Make sure you keep visiting your doctor.
Absolutely, and obviously bring any concerns you have to
Yes.
the attention of your doctor. On the stroke side, you need to address the risk factors for stroke. And as you said before, there's some strokes that are not preventable, but 80% of them are.
80%. That's such a staggering statistic that's why we do this, because we want to bring awareness to people. If we save one person's life, feel like we're doing our work, because
That's true.
it can be saved.
Exactly right. And we both, Jason and I, will be very happy if there's a day where we don't have anything to do.
Yes, yes,
And
yes.
that's our mission. Until that day comes, obviously we're trying to offer our services. But people need to be. The problem with stroke is that it doesn't hurt. There's no warning signs like chest pain for the heart attack side, and so people tend to ignore the risk factors. High blood pressure most of the times does not cause symptoms. High cholesterol does not. So people just
It's
live
like
their
it's
life
almost
without-
like
They
it's
ignore
almost
it.
it's not like because sometimes you don't feel well
yeah.
and you just push through it,
That's the other
push
thing.
push through it, you
Happens
know,
very frequently.
and
Because life has to move on, right?
life has to move on.
But the problem is that ignore those symptoms,
Right.
and life is not going to move on.
Yeah,
And
yeah,
a lot of times when we find an aneurysm, incidentally, that's like if we've had patients that were in a car accident and they wind up doing a scan of their brain and they find an aneurysm, and then they come to us, we confirm it, and we're able to treat it. They get very upset because they think, oh, my life is, and it's like, no, you've been given a second chance on
Yes.
this. We've caught this before anything has happened. It's
that's
kind of a
probably
reason to
why they had the
celebrate.
car accident. That's probably why.
Sometimes.
I mean, I'm just saying, like, because my father, he was walking down a hill and he broke his ankle.
Yeah.
Well, when he went into the hospital, he found out that he could have had a heart attack. If he didn't, they had
was
to.
a sign
Right,
from
it was a
God.
sign.
Gotcha.
It was a
Gotcha.
sign, like,
Yeah.
you know
Yeah.
what, you broke your ankle, yeah, but if you weren't in the hospital, you wouldn't have found out that you would have had a heart attack if
That
you
your
didn't.
arteries were blocked.
Yeah.
Yeah, you
So-
talk to some of our patients. That's kind of the approach that they
Yeah.
take as well.
Sometimes you have to take things in a positive manner rather than a negative manner. Like, why is it happening to me? Well, it's a good thing you're aware that it's happening to you, because at least you have the ability to change the direction, change the course, do something about it. It's those of us that have suffered strokes that are laying in the bed, like I said to you
Could always be
before,
worse.
that I literally remember, I vividly remember, like, seeing or visiting with them, and in their eyes they're crying for help because they don't know where they are or what just happened, or their whole, we talk about modern terms, it needs to be defragmented, their brain, because it's scrambled. Or it's inflated when you have a stroke, when you have aphasia, suffer from aphasia, that part of your brain is inflamed, so that's why you're suffering from aphasia.
Exactly right.
Wow. So Jason, so your day to day, like, what is it that you do? I know you travel with Dr. Kimon, but what's your day to day? Like, how do you impact?
So I assist him in the endovascular procedures.
We'll talk about that in a minute.
From treating a stroke or a diagnostic angiogram to maybe the patient had an MRI or a CT that could possibly have shown something. So we'll do we kind of call it the angiogram the gold standard, the gold study. So if they think they see something, we can find out for sure.
Wow.
Because we have what's called a biplane room, an angio suite that we use. That was one of the investments from Good Samaritan, from CHS to the program. And it's, when I say technology, I'm all about technology. It's extremely high tech. We can do 3D rotations of the blood vessels right there to manipulate it. So maybe if the aneurysm's on the backside and it'll be very hard to see, we can see it that way, and then send those coordinates to the room, and they can kind of manipulate that and mimic it so that we could duplicate that and really see what's going on.
Wow. That's incredible. When I was in the hospital with my dad, he was in ICU for 2 weeks, and we're so lucky to live each day in our regular, people go to work and, they have their children, but the world inside of a hospital is it's so difficult, and it's so, it's just moving that you realize how valuable life is when those kind of things happen.
There's nothing more rewarding than, we've been on call since the program has opened, and that was,
How long has the program been open?
Since September 13th of 2017.
Okay.
About a year and a half.
Yeah, about a year and a half now it's going
Wow.
on. But one of the most rewarding things, and we always say it, is, if you get that late night call and you got to get out of bed, is that by the time the patient gets off the table, they could be moving that side that was totally devastated. We had a patient walk in a support group one time, about a week and a half after we treated him. We got called 2 o'clock in the morning on a Friday into a Saturday, and we didn't recognize the patient when he walked in. We kind of did a double take, like, who is this? A patient that we didn't treat? Is this a patient that we don't know? And we were kind of talking to him, and we realized who it was, because he was so devastated. He couldn't move his entire side of his body. His face was a little contorted, and now he comes to support group meetings. He's a real personality. So
wow, that's incredible. That's incredible.
And this is what really motivates us.
Right.
If somebody shakes your hand on the table, 2 seconds after, because this is done under local anesthesia, so they're awake, and they're able to shake your hand with a hand that wasn't moving a second later. That's what gets us going to get those calls into in the morning, as Jason says.
So you were talking about non-invasive, minimally invasive. But what happened? I mean, how do you open up the brain and know what to? I mean, that's pretty intense.
That's Friday.
The point. That's the point of training. Obviously, we strive to treat people with minimally invasive ways. But there are cases where we have to open the skull and either go deep in the brain and put a clip at the base of the aneurysm, which is, as I said, think of it as a balloon that you pinch off at the neck. Or for stroke victims, sometimes they're not candidates to open their blood vessels for whatever reason, out of the window or otherwise. And then their brain starts swelling, and we have to remove the bone to prevent an even more catastrophic and lethal event. We do what we do. I mean, that's the point of me being a neurosurgeon and able to do both sides of both the minimally invasive side and the open surgery side, and that's why we trained for a long time, over 8 years, to be able to do these procedures.
And you were just saying that's why you got into medicine, because of strokes. Tell us a little bit about that.
Exactly. Now, I was my motivation was not necessarily an experiential problem. It was not that my family suffered from stroke. But it was more my passion to be able to change the course of a disease that it's so silent, and it dramatically impacts patients and families. And when I was thinking about becoming a neurosurgeon, stroke care was not as advanced from an endovascular perspective, and brain aneurysm care was not as advanced.
Right.
But my passion was to be able to impact this disease with any tool I had available. So the changes that led to this more minimally invasive approach actually were welcomed by me, because I wanted any tool at my disposal to treat the disease, and the more tools that exist, the happier I am.
Wow. Now, do you guys use telemedicine?
We do. So the way, obviously, having a comprehensive stroke center and multiple spoke hospitals, we need to employ tele-stroke services, which is the telemedicine for stroke. Right. So we need to employ telestroke services to allow us to examine patients out of the facilities, or sometimes to even be able to bring our neurologists to the patient's bedside within a minute. Not having them to come from home, and they're able to immediately impact the care, examine the patient via the computer, and make a decision about TPA, the clot-busting medicine, or me making a decision about mechanical thrombectomy, and then mobilizing the team appropriately. Our goal is to bring down the treatment times to as low as possible, and we've made tremendous advancements, even in our short tenure at the Stroke and Brain Aneurysm Center of Long Island, to bring those times as low as possible, to the point where these people get treatment as in a really expedited manner.
Wow. I was listening to what you said. I forgot my next question, but it's because telemedicine. Does the insurance? No, that's a whole thing, because in
we're
New Jersey,
exploring that as well.
In New Jersey, I know that was some of the difficulties for hospitals to use that, because it was
not covered
by insurance,
and it still isn't. So the reason we use it is because we see
the value in it.
We see the value in treating patients in an expedited manner, and sometimes you have to go beyond what insurance allows to get patients well, and you being able to offer the best services possible, and you wanting to be the best in offering those services. However, insurances have rules about telemedicine, and that's a whole different conversation, but in brief, telemedicine is only compensated in rural areas, and rural areas are defined
by the distance,
some criteria, population, distance, things like that, not necessarily by the need. So if you're in a urban, suburban area similar to Long Island, it's really not compensated.
I know, because I was working with the American Stroke Association,
Yep.
because they were because they have people in Congress and that that go and fight it, and
Exactly.
so I signed and I was a part of that
Petitioned, yeah,
petition
exactly.
as well.
Yeah, and I'm on the board of the American Heart and Stroke Association too for Long Island, and I applaud your help in the past. This is part of our mission. Because when there's financial incentives, obviously things spread a lot quicker. So if telestroke is a compensated service, then you will see a lot more of those services for the benefit of the patients at the end of the day. Because some hospitals, not necessarily large hospitals, not necessarily comprehensive stroke centers, but smaller hospitals struggle with their finances. So if they don't have the ability to offer compensated services, they might opt out of treating stroke, and that's really not going to be for anybody's benefit, because patients will show up at their doorstep and they're not going to be able to receive their care.
I can't comprehend having a conversation with a congressman or an assemblyman or a senator or the president, whoever it is. I can't comprehend having a conversation with them, and given the statistics that you have provided for us today,
If they don't understand, they don't want to.
right, proven statistics, as far as every 15 minutes. I mean, just the whole thing. What?
We don't understand what's blocking them
Like,
from moving forward.
Well, I know what it is. It's money.
But
It's
money
the
shouldn't be the most important.
That's our thing. Money shouldn't have anything to do with somebody's health recovery. Shouldn't have anything to do with it.
Exactly, and we're facing obviously political battles all the time, and that's on our side, and on my personal and Jason's side. We volunteer our time for organizations such as the American Heart and Stroke Association, or other non-for-profit organizations. Jason and I are very heavily involved with the Lisa Colagrossi Foundation, which is a brain aneurysm awareness
Yes,
foundation.
she's Channel 7.
Exactly. So
She died.
exactly right, and
She was on the air, right?
Yes, she was actually
shortly after, and we're very supportive of their mission to increase awareness for brain aneurysms, and they've done maybe the most tremendous and impactful advertising campaign to get the word out there, and we volunteer our time for these missions because we feel that it'll eventually pay off by getting more patients to a quicker diagnosis and recovery. But unfortunately, that's why we have these organizations, because they have to impact policymakers, thought leaders, and they do it by getting the message out there and getting these statistics hammered down so that the people that make decisions really cannot escape them.
But I applaud you because your organization, your hospital, or it's the hospital that leads the way in this, that you're doing the telemedicine, the telestroke medicine, without the impact of the insurance covering it, because eventually you will prove to them with your numbers of saving lives and saving the quality of life. That's what I always say, some people do die from a stroke, but what about those that their quality of life is severely impacted? And not only that, but it affects their family. I remember when I went to a recovery center and everybody was talking, and they were having, we went around the table and everything, and always at all recoveries, I don't know about yours, but the topic of insurance comes up. And one woman was saying that, her husband was home, he couldn't move, he was in a wheelchair, but she had to work to support them. But on her break, she was fighting with the insurance companies, and her life was just devastated, and it was no relief from it.
No, and it's very common, unfortunately. It's hard for people to focus on getting better or getting back to health when they have to fight all the other battles. And as far as we're concerned, we're trying to minimize that impact.
Right. That's what we always say. Let the person recover. Let them recover first, and then then you can worry about everything else. But our lives are so important and so valuable. It just I that's why I'm passionate about it. Sorry.
and we applaud your passion.
Oh, thank you. So Jason, you guys have a stroke recovery center. Tell us a little bit about that.
So we have a support group that we started. We started the January 2018, a couple months after the center was open. We kind of wanted to get our feet on the ground, wanted to get established. And we have a great following. We have some great patients. We're open to all patients of Long Island because obviously the disease has been here longer than we have. So I've had people call up. My father had a stroke a couple years ago.
Oh, wow.
I saw your flyer because we meet the fourth Tuesday of every month. Except for this month, we change it up because it's Christmas.
And
that
Hanukkah.
time.
A holiday party.
So we're having a holiday party as a thank you. We really focus on education. So we try to educate the patients about stroke, some breakthroughs, some facts that's going on, aneurysms. The support group is for patients who've either had an aneurysm or a stroke. We combine that because when you talk about neurological disabilities that can kind of come from both those diseases, they're going through the same thing. So to have more people that are going through the same thing, I think you're going to get more out of it. And we really are open to family members as well. I like to focus on family members because there's a whole other side of that coin that they need support and help too.
You could say that again.
Right.
Yeah.
Right.
I mean, we have one granddaughter who's taking care of her mother and her grandmother that had
Wow.
an aneurysm. And I call her on the phone. I try to call up at least once a month to see how she's doing. It's so hard for her to even get out of the house. I think her and her husband play tag. One comes home from work, the other one's leaving, and they're taking care of these people. So the family members really need the support just as much.
They
so
do.
even if I encourage family members to come, even if, especially men don't want to come and say, I need help. But you see, we had one family member, her husband was in the hospital for 3 weeks. He had an aneurysm rupture. He was intubated for most of that time.
Wow.
He woke up. He's back to work now. He's doing fantastic.
And he didn't know what she went through the whole time.
Yeah, no clue.
Yeah,
And she had her kids come, didn't know if they were saying goodbye, from
right,
day to day.
Yeah.
He had multiple surgeries. He came down to the Neurovascular suite multiple times. And he's doing great, but I think she has some almost like PTSD over it. And I said, just come. Like, you don't have to bring him. Like, you went through hell yourself. Like, by all means. So we definitely encourage that.
I can understand that because I went through that with my dad's stroke.
Mm-hmm.
Yeah. And I'm sure that there's questions that you would have had. There's resources. Like
I didn't know about you at the time. That's why I'm going to
We were not here.
shout about what you're doing to everybody that will listen.
Yes.
What time do you have to be at your next?
We should be leaving at 10:30.
Yeah.
Okay, so I just want to make
We're
sure
good.
I'm time zone. with
I've
you
been
guys.
keeping my eye on it.
Yes, yeah. Well, I mean, we usually have to cut out at 10, but is Pamela? She.
You haven't heard from her?
Okay, all right. So I just want to make sure we're not, our time zone, because it flies. We've been doing this for an hour already.
Oh, wow.
So it
Doesn't feel like it.
I know, because we have so much to share with everybody, and we want to make sure that we share. But give Dr. Kimon some of his accreditations and his awards that he has won.
You have another
Yes,
hour?
I know. I mean, it is incredible, and we're just like how many? Like maybe 30.
There is, oh my God, pages.
30,
boy.
But I'll
30,
go
40?
through some
Just
of them.
good, just some of them, just so you could see the passion and the knowledge that we're experiencing.
Dr. Kimon Bekelis.
You got it.
You
Dan.
got it.
Bekelis.
Fellowships and Awards. 2018 Contemporary Award honoree awarded by the Long Island Elite. 2018-19 CNS Leadership in Healthcare Fellow awarded by the Congress of Neurological, I can't say that word.
Neurological?
Surgeons. 2018, the Science, Stroke, and Brain Aneurysm Award, awarded by the American Heart and Stroke Association. 2017, Leadership Summit Scholarship Award by the American College of Surgeons. 2016, Sam Hassenbusch,
Wow.
Young Neurosurgeon Award, awarded by the Congress of Neurological Surgeons, and 2016-17 Health Policy Scholar, awarded jointly by the American College of Surgeons and the American Association of Surgeons.
That reminds me of
It's very impressive.
my neurologist, because I had a stroke in New Jersey, and of course it was over 30 years ago. This is a next year on May 5th is our 5th annual telethon, but on April 8th is my 30-year anniversary of my stroke.
Oh, congratulations.
And thank you. Thank you.
To celebrate.
Yes, something to celebrate.
And
but
it happened on the
softball
field.
But why I'm saying that is my neurologist, Dr. Littmeyer, he had the same humble intake as you have, and I went out to dinner with him. I went out to lunch because I had to get his approval, his authorization to use his name in my book. And he said the same thing to me. He says, I didn't start this to get all these acclaims. He goes, I just did it because I really want to help people. I really wanted to help people. And the same thing with you, your passion. But, when people see that you're just driving it and you're just doing it from this place of humbleness and care and just really make a difference, and you're doing it in a meek way, but you're really the meekness, I think, is more powerful than those that go in and, demand things. You're doing it with your knowledge and your education and your statistics. So I really just want to thank
you.
Well, one of the greatest feedbacks that he gets, I mean, personally, I know this to be true, but from a physician, his bedside manner. I mean,
Yes.
the way he sits with the patients when they come to the support group, they talk so highly of him, and I don't let him come to all the support groups. I kind of keep him away. He wants to come, but then I feel like it becomes like
Yes.
I want them to be themselves.
Yes.
I don't want it to be an impromptu office visit.
Right.
And they fawn over him, so they become like a rock star walking in the room.
And Dr. Littmeyer would the same thing too. Like, usually when you go to a doctor's office, it's like, okay, I have 15 minutes. What do you want? What do you need? But actually,
they don't even tell you that.
I know.
They're looking at their.
But no, we'd sit down. He'd check me out, and then we'd go in his office. He'd sit down, talk to me. Like, it's the bedside manner. It's so important, in life. So thank you so much, both of you.
We're really honored.
Yeah.
Thank you.
Yeah.
And to know both of you and to be able to promote what you're doing.
Thank you.
So give us like, you have this platform. I mean, it's going to be on the internet forever. I can clip it. We want to help you in any way we can to bring awareness to this, to strokes and aneurysms. So, let's start with you, Jason. Like, what would be the message that you want to give to everybody,
Just awareness that we're here now. From coming from nothing, you'd be surprised even in the community that people close in the South Shore still don't know that we're here, that we offer these services, that that we're affiliated with all throughout CHS. Just the amount of effort that went into it, and that we're here, and these services are available. Don't hesitate. Get to the hospital. Get to a hospital. And you will be taken care of, and you will have I'm proud to say, some of the best care available.
That's so good. That's so good. Do you know Sharon Bean by any chance?
No.
Okay, because she's a part of the American Stroke Association.
Going to leave the legacy of my parents had stroke and heart issues, and I wanted to leave that in my will. And I contacted Sharon, and that's how I got her involved with us.
Oh, wow.
She's an incredible individual. Incredible.
That's amazing.
Incredible. She's actually the one that really helped to get this show off the ground.
Yeah.
Because Judy was, working with her, and she would keep sending people to us.
Amazing.
Just, guests to us. And it really helped us launch us because, I went into this, to Madhouse TV, talking about the telethon, not having a show. Mm-hmm. And all of a sudden, Bobby Baby Walker's over here talking about doing a show. I'm like, Bobby, we don't have time. And anyway, so
here you are.
Here we are, 4 years later. I think it's 4 years later.
Oh, wow.
It's unbelievable. Wow. So give us
My message, I think, is time is brain. So that's the most important message that we can, I think, offer to people. And really, we have a spectrum of educational materials available, and we offer our services at all times. And if folks want to reach us, we have obviously significant social media presence, but I would start with our website, which is strokecarelongisland.com, and through that they can find our social media through Twitter, through Facebook, through LinkedIn. I'm looking at Jason because he knows more about that than me.
But if you send them to me,
There you go.
Absolutely.
Send them to me, and when I do, I'll send it out to everybody,
good. Yeah.
and I'll put it on our website so that everybody could follow it.
Good Samaritan Hospital. That if you
We'll give you all the websites.
Yeah.
That all comes up as well.
That way, I believe that our motto is together we're lifting our voices and changing the face. The face is the the conception that it happens to elderly people of locally and globally of strokes and aphasia. That's our motto.
Our friends at American Heart actually just put me in contact with a 22-year-old gentleman who had a stroke who wants to get the word out. He did the bad thing of driving himself to and from. He didn't feel right.
We'd like to invite him to our show.
Yeah, he could definitely.
He's too far away.
Absolutely. He wants to
He
reach
could
people.
Skype in, or
And
we could invite him.
He's local. He's Long Island.
And
yeah.
his story.
Give him my information.
Absolutely. His story is very impactful. Our youngest ever brain aneurysm rupture was 27 years old.
I
Wow.
think she was a little younger than that.
Yeah, 26, 27 years old. And she's right as rain today, like nothing happened. But these diseases really span the spectrum of ages, and they can be devastating in the young or the old, but especially in the young. 30 years later after your stroke, that's not a small feat.
I you know what, and I know my arm is still a little, tight and everything, but I know God keeps it that way. So I never forget what I need to be doing in my life. He didn't let me recover all the way because it was like, I'm going to leave that there, Renee, so that you can always remember that you have work to do.
That's a good attitude.
Yeah.
So, all right. So we're going to take a quick break, and we're going to come back, and I'm going to sing some songs, and we'll thank you guys again. But we're honored and privileged, and I hope you'll come back. When you have anytime, the door is always open to come. Even if you want to Skype in for 5 minutes one time, if you're doing anything, whatever way we could support you.
And
please.
you're welcome to come to our 5th annual telephone.
Yes.
That would be great.
Yes, that's going to be incredible. We'll be right back.
Thank you.
Got me good in a hole that I just can't diffuse, but I know the tricks up your sleeve. 'Cause you and I used to sing just to pass by the time, and I can't let go without a partial thought to where our song may flow. Some ring away, but the echo of yours seem to stay. And lately when I listen close, what I hear may be fake. See, you be real now, and I'll be honest, that what we've got here is truly harmonic. And I can search just to hear the same sound play, but why would I when you're standing here right in front of me? Truly harmonic. Oh, you've got me good. It's a concept I just can't refuse, but you had to see through what seemed without flaw. So you may say that this anthem of ours long away, maybe it's true. So when this sound leaves my ear, I can't help but to sing it again. Hope that if I sing it out, maybe you'll comprehend. I've been around now, and all is silent. What we've got here is truly harmonic. So when you think of me and the lyrics that we used to sing, and take them for more than what they appear. 'Cause all along if the sound of our music stops playing. 'Cause maybe the next time around things won't be the same. Without exchange, see, you be real now, and I'll be honest that what we've got here is truly harmonic. And I can search just to hear the same sound play. But why would I when you're standing here right in front of me? Truly harmonic.
Check my hair. Oh, am I on? Well, it's true. I watched The Voice the other day, and they showed what they do in between. And Kelly was getting someone like doing her hair. I'm like, I need that.
You want me to do your hair?
No, I don't want you to do it. Oh no, I need just somebody, you know. Oh, there I am.
You want to be like Gilman, so
Yeah. No, when we, because we're bringing this. I always say that we're bringing this. What do you call it, Jim? When you're bringing a segment on each show, I don't remember, but I wanted to replace the Kelly show.
Oh, okay.
Yeah. So we're gonna replace the Kelly show on NBC. We're not literally going to, but that's our desires to do it. Don't spread rumors. So anyway, of course we always like to sing, especially because it's the holidays. So I'm gonna sing a little "Oh Holy Night." And then, of course, we're going to roll it out by singing a fun song, Feliz Navidad, because I always add in have a Happy Hanukkah and a Merry Christmas. Did you get it, Jim? Okay. So here we go, because music is praying twice. That's my motto. Sin and error pining, Italy appears, and the soul felt its worth. A thrill of hope, the weary world rejoices. Go yonder-ing a new and glorious morn. Oh, on your knees, oh, hear the angel voices. Oh, night divine, oh, night when Christ was born. Oh, night divine, oh, night divine. So sweet of the music. How do we look, Jim?
a thrill of hope. The weary world rejoices, go yonder reign the new and glorious morn. Oh, on your knees, oh, hear the angel voices, oh, night divine, oh, night when Christ was born, oh, night divine, oh, night, oh, night divine, oh, night divine. I love to sing. So we're to the end of the show, and we want to thank Dr. Kimon and Jason and Jim, of course, and Judy, my partner in crime here. We're so happy with the work you're doing, and really we're privileged.
Thank you.
So I can't say it. Yes, I can't say it enough. So please join us in singing the next song.
I cannot sing. I'm done.
Yeah,
We're
no.
not very talented in singing, but we're participating, but just listening.
Yeah, but it's a good song. You won't even hear you guys sing. Just mouth it. Okay, Jim, we're doing a little Feliz Navidad to roll it out. And by the way, wait for me, because towards the end we always blow our kisses.
All right.
All right, so I want to make sure everybody blows their kisses. Here we go, everybody. Let's go. Here we go. Ready? Feliz Navidad. Feliz Navidad. Feliz Navidad. Próspero año y felicidad. Feliz Navidad. Feliz Navidad. Feliz Navidad, próspero año y felicidad. Let's go! I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas from the bottom of my heart. I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas from the bottom of my heart. Let's go. Feliz Navidad, cha 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 cha. Feliz Navidad, cha 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 cha. Feliz Navidad, próspero año y felicidad. Feliz Navidad, cha 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 cha. Feliz Navidad. Feliz Navidad, próspero año y felicidad. Follow my lead, Judy. I wanna wish you a happy Hanukkah. I wanna wish you a happy Hanukkah. I wanna wish you a happy Hanukkah from the bottom of my heart. I wanna wish you a happy Hanukkah. I wanna wish you a happy Hanukkah. I wanna wish you a happy Hanukkah from the bottom of my heart. Let's go! Feliz Navidad, cha 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 cha. Feliz Navidad. Feliz Navidad, próspero año y felicidad. One more time. Feliz Navidad, cha 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 cha. Feliz Navidad. Feliz Navidad, próspero año y felicidad. Let's go back to Merry Christmas. I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas from the bottom of my heart. I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas. I wanna wish you a Merry Christmas from the bottom of my heart. Feliz Navidad, cha 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 cha. Feliz Navidad. Feliz Navidad, próspero año y felicidad. Okay, thank you so much, everybody. Have a blessed day. Have a wonderful, happy Hanukkah, our Jewish culture friends out in the world. And we will see you next week. Let's blow our kisses, gentlemen. Thank you, everybody. Have a wonderful day. I got lost in the music that I forgot to blow our kisses.
Que haré. Yo no sé lo que estoy perdiendo. Yo no sé lo que va a pasar. No me puedes escuchar llorar solo sin ti. No me puedes oír llorar. El día que caminaste por la puerta, todo fueron, mi corazón está vacío, como si tuviera ayer. No me puedes escuchar llorar solo sin ti. Mi corazón está sufriendo. No me puedes escuchar llorar solo sin ti. No me puedes oír llorar. Usted está en mi sueño por la noche. Por favor, no peleemos. Y es tan difícil para mí y para ti. Yo, ¿qué puedo hacer? No me puedes escuchar llorar solo sin ti. Mi corazón está sufriendo. No me puedes escuchar llorar solo sin ti. No me puedes oír llorar. No me puedes escuchar llorar solo sin ti. Mi corazón está sufriendo. No me puedes escuchar llorar solo sin ti. No me puedes